Hello viewers, I am Dr. Rahul Reddy from ANDROCARE Andrology Institute, Hyderabad. Today in this video we will be discussing about testicular pain in males. This is a common issue in males, and at some point in their life they will be having testicular pain, and we have seen patients who continuously have testicular pain and we also see a set of patients where they have stopped everything, they stopped working and just taking painkillers every day for this testicular pain for years together. So now, why this testicular pain is a chronic issue and why it is not getting relieved in spite of taking so many medications? So to understand this, or you have to understand the mechanism of testicular pain. Actually, then only if you know the root cause, then only it's easy to treat. This is not only for testicular pain or any problem in the body. Unless you find out the root cause, it is difficult to treat. Now, in the testis, if you have to understand why testicular pain comes, then testis has some four parts. One is testis. Second one is the head of the epididymis. This is in the scrotum actually, and body of the epididymis and tail of the epididymis, and then comes the sperm tube. Now, pain generally originating from the testis itself is very rare, because whenever there is infection in the testis, generally if this infection, we call it as architis. This architis is a dangerous thing. Most commonly this is acute architis. The moment infection enters the testis gets swollen, severe pain, and most of the testicular tissue gets damaged with this architis. But architis is very rare, and this is not a common cause for testicular pain. So now most common cause for testicular pain is infection in the epididymis, and the nerve which carries the pain signals from the testis to the spinal cord, that is getting damaged. These two are the common issues. And why this nerve gets damaged? Again, it can be because of long-term varicocele and excessive heat in the testis, and even this infection in the epididymis and spermatic cord can damage the nerve. So now, apart from the nerve, then coming to the infection, where this infection comes. See, now this external infection in the skin, it can't go to the epididymis directly, because there are around 3-4 protective layers. It is almost impossible for an external bacteria which is on the skin and going into the testis is almost impossible. So now, from where this infection comes? So now, if you are to understand, then there are 3 sources of infection which can cause testicular pain. So one is through the penis, lack of hygiene, the people having phimosis who are not able to clean the tip of the penis properly, and people who are not cleaning the penis in inner part of the glands, inner part of the prepuce regularly. This can lead to accumulation of infection, and which goes into the penis and then enters the sperm tube. This is one possibility. Second, any infection in the urinary tract or urinary infection, this infection can enter the genital tract and cause testicular pain. And third probability is, see now, if you have to understand the anatomy, this sperm tube goes up and joins into the sperm stores in a reservoir called seminal vesicle, and this seminal vesicle is just behind the prostate. So now, if there is infection in the prostate or seminal vesicle, then this infection can cause testicular pain. But from where this infection comes to prostate, apart from these two causes, like external source through the penis to urinary tract infection, the third common cause is through the bowel. So people who are having hemorrhoids, anal fissures, constipation, inflammatory bowel disease, all these under Crohn's disease, All these things uh, accumulate, the bacteria accumulate in the bowel wall, and it gets transferred to the seminal vesicle. Through the seminal vesicle, it comes to the testes. Now, if you understand this, then treating is easy. Now, how to identify and treat is, now normally people, what doctors, most of the doctors do is, they give antibiotics and painkillers for 4 to 5 days, and then they ask them to come back. But the trick here is, now most of these infections are chronic infections. You can't treat them with high dose antibiotics for a short term usage. You have to give them, you have to identify the bacteria. It can be a bacteria, it can be a fungus, it can be a virus. So now you have to find out what is causing that. Second, if it is a bacterial infection, then you have to give long term low dose medications. So now, what if, in spite of taking all these medications, in spite of bacteria, the infection going away, but what if the pain persists? So in these cases, we have two therapies. When medications are not working, we have two therapies. One, if the infection, the source of the infection is prostate, that means either prostatitis or seminal vasculitis, then we can do a shock wave therapy, low intensity shock wave therapy to the prostate, which increases blood supply into the prostate and which gives anti-inflammatory effect, and it helps in healing the prostatitis or seminal vasculitis, thus improving testicular pain. This is one way of treating that. And people who, if it is not a testicular prostatitis, then there is a small, very small surgery called spermatic cord denervation, where here what we do is, we make a small cut, and we will identify the nerve which is causing this pain, and we have to cut those nerves. This is called spermatic cord denervation. It's a very simple daycare procedure. Mostly it's painless. Now, by doing this, what happens is the pain gets relieved, and there is almost 90% chance that the pain goes away completely. So now, this, see, why we made this video is, there are so many people with chronic pain, chronic agony. Sometimes we see people with suicidal tendencies saying that, doctor, since 7-8 years this pain is continuous and I'm not able to concentrate on any other work or my studies. So this video is for them. So the main idea of this video is to tell them that there is some solution at every point of the problem. Whether it's a prostatitis, whether it is an urinary tract infection, whether it's a penile infection, we can cure this testicular pain. So if there is chronic testicular pain, meet a local urologist and get it evaluated properly. Thank you, viewers.